Everyone, so today we are going to start with our new topic, that is acute otitis media, which is a chapter of ENT. So starting with it, first of all, it is the acute infection of the middle ear. So what is its etiopathogenesis? So the most common route of the infection, it is a eustachian tube, that is from the pharynx. So as we can see in this diagram, here it is our pinna, and there it is the tube like external auditory canal, and after that there is tympanic membrane, and above to it there is middle ear cavity, and below to it there is eustachian tube. So if there is any kind of infection entering from our pharynx, then it reaches to the eustachian tube and it may obstruct the middle ear cavity. That is only the otitis media occurs, how it occurs. Okay, so most common route, as we know, that is eustachian tube, and the prerequisite is most common, it is like viral pharyngitis. So if there is pharyngitis, there will be bacterial superinfection which leads to otitis media. And the most common cause of the pharyngitis, it is the streptococcus pneumoniae or the pneumococcus. Okay, so there are also causes such as viral, but bacterial cause is the streptococcus pneumoniae. Now let me see that what are the stages of the acute otitis media. In this, first there will be eustachian tube obstruction, in which there will be edema of the eustachian tube that will lead to the blockage of that eustachian tube. So what are its clinical features? So clinical features will be like retracted tympanic membrane, due to which there is will be negative pressure in the middle ear cavity. Now, second stage will be hyperemia, or the stage of the pre-suppuration, in which there will be inflammation of the walls of the middle ear, and there will be increased vascularity. Okay, increased vascularity that will cause the exudation. Now, what is its clinical feature? Its clinical features represent such as severe pain, cartwheel appearance, in which the severe pain, cartwheel appearance, in which there will be radially running vessels on the tympanic membrane. So, guys, now in this, as we discussed, that there will be hyperemia. Now what will it appearance? It will appear as cartwheel appearance, in which there will be radially running of the vessels on the tympanic membrane, and the diagnostic, which is the diagnostic of acute otitis media. So as we can see in this diagram, there will be radially running vessels on the tympanic membrane. Now the next stage, it is the stage of the suppuration, in which, as the name suggests, it is the pus formation in the middle ear cavity. So if there will be pus formation in the middle ear cavity, then the maximum pain due to pressure on the tympanic membrane occurs, due to which there will be tympanic membrane bulges out, and it may also rupture the tympanic membrane. So but the pain will be relieved, and the most common site of the tympanic membrane rupture, it is the posterior part. Now, if the pus occurring in this stage, it is also called pulsatile otorrhea. Now, what will be its management? Oh, before discussing the management, we can also see this diagram, in which this is the middle ear cavity. Now we will see that first stage will be tubal obstruction. Here it is the eustachian tube. This is the infection carrying out from the pharynx, which leads to the blockage, and after that there will be hyperemic, and after that there will be pus formation in the middle ear cavity. Now its management part. First of all, the mainstay, it is the antibiotics against the streptococcus pneumoniae. Decongestants are used to relieve the edema, and the analgesics are used to for the pain relief. Now, if there will be severe pain, now the management is also classified. Now it will be if there is severe pain and the reddish tympanic membrane and congested and cartwheel appearance, or there is slightly bulging out. So the management will be antibiotics, analgesics, and the decongestant. Now, if there will be pain, congested, and there will be not slightly bulging, it is full and bulging, which is impending rupture. In this, we have to do the meningotomy, in which there will be incision and the drainage of the pus from the middle ear, and also the antibiotics. In tympanic membrane rupture, perforation is irregular. It might not heal, but in meningotomy, incision is clean and it also heals. Okay. Now, if there is any complications such as facial nerve palsy, labyrinthitis, it also presents with vertigo. In that case also we have to perform myringotomy. Now, facial nerve palsy, it is due to the increased pressure on the facial nerve, and the 50% of the population has dehiscent facial canal. Now, if we discuss the what is a procedure called myringotomy, that is making an incision on the tympanic membrane. Okay. Now the most common site, it is the posterior inferior quadrant. As we can see in this diagram, it as we can see the tympanic membrane, it is a handle of the malleus. From there will be the right side and the left side. So right will be anterior and posterior part. Now the above part is the superior and the inferior part. Okay. But the incisions should be given in the posterior inferior part. There is a posterior and the inferior part. Okay. Now it can be curvilinear. Okay. Never given in posterior superior quadrant. If the incision is not given in the posterior, if incision is given in the posterior superior quadrant, then it can lead to the damage of the incus, incudo-stapedial joint, or the oval window, or the facial nerve. As we can see in the diagram, that in the superior part there it in we can refer this diagram, there will be incudo-stapedial joint, there will be oval window. There are major structures. If we put incision on the posterior superior, it can lead to damage. Okay. Now the shape of the incision will be curvilinear, and if there will be ruptured tympanic membrane, then if tympanic membrane is already ruptured, then we have to give antibiotics, decongestants, and analgesics, and it will also heal by 3 months. If doesn't heal, then it needs to be repaired. Now, another one is bullous meningitis. In bullous meningitis, it is also known as meningitis bullosa. It is the bullous bulgement on the tympanic membrane. The patient will be presented with a severe complaint of pain, severe pain, and the most common organism in here also is Streptococcus pneumoniae. Other organisms such as influenza, virus, mycoplasma, pneumonia, and the management, it is antibiotics. Okay, thank you guys.